as we kick off, we're going to hand over to the first speaker of side proposition. Now, our first speaker in favor of the motion is Shona. Shona is a secondary school teacher. She's a teacher of history at a school in North London, which I won't name to avoid breaking her anonymity, even though we have listed her full name. Shona is a school teacher, so as you can see, has a very immediate stake in the debate being held today. Shona, in her past, before going into teaching, worked in the Department of Education as a civil servant, so hopefully we'll have some more insights into some of the policy decisions behind this, in addition to her frontline perspectives of working as a teacher, both pre and during the pandemic, and now post, I suppose, if we can be optimistic and hope that the pandemic is winding down. So what I'm going to do is I'm going to hand over to our first speaker, Shona, to begin the case for the proposition. As each of our speakers start their speeches, they'll have 4 minutes. What I'll be doing is I'll be timekeeping their speeches, and I'll be offering some time signals at both 30 seconds into their speech and 3 minutes 30. I'll do a little clap. If anyone doesn't know why I'm doing that, that will become apparent very, very quickly, and I'll elaborate slightly further on that in a moment. But without any further ado, to begin the proposition's case for the motion before the House, this House supports prioritising keeping schools open as far as possible during COVID. The floor is now yours, Shona.
Thanks very much. What an introduction. I wish that I were well informed or articulate enough to speak from a policy position. I am very much not. I haven't done one of these in about 5 years and I wasn't much cop at it then, so please bear with me. But what I am going to speak to you about, and what the proposition I'm going to speak to you about today, is the known harm that we know that prolonged periods of time out of school do to children, and not just in the short term, in the long term impact that this has on life chances that we believe outweighs the impact on the case rates in the pandemic of having schools open. So to start off with what we know now about how COVID works amongst children, we know that the risk for serious illness and certainly the risk for death is very, very low for children, and that's not, I'm not saying that that's not something that we take seriously, and also for teachers, obviously we are at risk by going into school, but we are at a lower risk than many other key workers that have been working consistently throughout the pandemic, and there are steps that all schools are taking to limit the harm for teachers. But I'm going to talk to you about the waste of potential and the damaging effects on children's lives, and particularly disadvantaged children. So I'll tell you a little bit about my context. So the school that I work in has almost 3 times the national average, or even the borough average, I believe, of students in receipt of pupil premium, which is a mark of a disadvantage. So we really know the impact that these children experience from lockdown. So children crave routine, they need the normality, they need the structure. And we've noticed the children in coming back are many of them really, really struggling. We have had a flurry of child protection concerns raised by all members of staff as all issues come to light as children struggle to get back into school. So socialisation has been a big issue. We have had an exorbitant number of issues between children, fights in the playground, aggression, children just losing that ability to socialise normally. We've had children who are generally very sociable, very withdrawn, and really, really struggling to operate normally and socially, and that is directly linked to their time outside of school. And moving on, thinking about their physical health as well, so their mental health. Children have really expressed anxiety, low mood, struggling with sleep patterns, struggling with that complete loss of routine that doesn't just have an immediate impact, but also, as we know, has health implications that can be really, really quite drastic, particularly children experiencing other indices of deprivation as well. It also has an impact on their physical health. Children are growing. We've all heard a lot of the stuff in the news about children not getting their access to free school meals. My school was out delivering parcels by hand, but as with many schools across the country in the nationwide picture, that was not delivered, and many households were experiencing food insecurity. And on the other side, really, really inadequate nutrition. We had children coming back with shocking levels of fitness being reported by their PE teachers. And for growing children, yes, they bounce back, but this has a massive impact on their long-term health, and particularly so against children that are experiencing deprivation in other ways. And that brings me on to speaking about adverse experiences at home. So many of our children
information.
I'm about to run out of time, so I'm going to say no. So as a pastoral leader, as well as a teacher, I'm well aware of the issues of domestic violence that are going on in homes. And this, as we know from the national press, this has spiked during lockdown. This is damage that cannot be undone, damage that is repeated through generations. And we simply cannot risk children being at home where they are not protected, where they are not looked after, particularly when it is most impactful for the most vulnerable children already. Thank you very much.
Excellent. Huge round of applause for Shona. Thank you very much for an excellent opening to the proposition's case and some excellent usage of spec knowledge from your own experiences as a teacher at the moment. Brilliant. So I'm seeing a lot of people who, the audience we already had swaying 78% in favor before the debate in our pre-debate poll. I'm sure there's now probably even more people who are leaning towards the side after such a strong opening. So opposition's got their work cut out for them, but I'm sure that our three opposition side speakers are more than ready to rise to the challenge. So on that note, I'm going to introduce the first speaker for side opposition. So the first speaker on the opposition side speaking against the motion is Jasper. Jasper is one of our members of the Goldsmiths Debating Society. So he has been a member of the society for a number of years now. He's in his final year. We're very sorry to be seeing him graduating this summer, but we're glad that we got him in to do a show debate before he leaves. We're making full use of having him here while we can. Jasper has been involved in the society for a number of years. He's been involved in various capacities, including as the training officer. So he's been teaching all of our other members how to debate. And so you'll get to see him putting his own skills in action in just a moment. I'll let, from this point on, Jasper's words speak for him. I'll hand the microphone over to Jasper to open the case for the opposition side. Here. Over to you, Jasper.
Thank you very much. I hope I live up to that glorious introduction. So on this side, I think we primarily have 2 points. One, what has lockdown achieved, and how could keeping schools open more than we did, or as much as we did, how has that influenced the progression of the disease through society? The second, a lot of the disruption in school has been caused by online teaching, but with a policy of lockdown, there would be disruptions no matter whether we kept schools open or not. And so we'll be exploring some of those issues as well. But before I talk about those things, I think I have to talk about something that will happen over the coming years. As we move further and further away from COVID, and the potential of deaths in those people around us move further in the distance, it becomes a memory. But we will be stuck with the legacy and the effects of lockdown and the effects that that's had on the children and the people in society. It will be tempting to forget why we instituted these policies of lockdown. And I believe we will see public opinion shift. It was hugely in favor of lockdowns at the time, but I think we will see lockdown regret increase and increase. So I believe on our side, we have to give really a historical account of why we entered lockdown, what lockdown has achieved, whether schools opening would mitigate the benefits of lockdown, and really look at the costs and the benefits that we have faced as a society. So we'll start with why we entered lockdown. We were faced with an unknown death rate. Estimations were between 2 and 5%. The R rate was predicted to be around 2%, meaning that it would have exponential growth. In this country and many other European countries, by the time we were considering measures, there were already cases that were not linked to travel. So it was already in the community. This made it incredibly hard and the possibility of eliminating the disease quite far off. We also did not have a strong testing capacity in this country. We were not able to track the disease, let alone test the number of people that we wanted to. People who wanted a test or thought they had symptoms were not able to be tested, and we were not able to find out where the disease in this country was. With these measures, the government decided that lockdown was the policy we would move forward with. Now, there are lots of criticisms. Did we enter lockdown too late? Was lockdown worth it? But I just briefly want to talk about what we have achieved. We now have a better estimation of what this disease is. There have been studies and the death rate has been confirmed to be probably around 2%. The R rate is probably between 2 and 6, depending on the country it is in. In Europe, many studies put the R rate at around 3. This isn't really important because anything above 1 or 2 leads to exponential growth that we have all seen in the first and second outbreaks of this disease. Now, what would have happened without lockdown? How would the world be different in the UK if we had done nothing? It's very hard to say. We don't have very good evidence of how many people in this country have had the disease, but the R rate guides the proportion of people that need to cap the disease to get herd immunity. With an R rate over 2 and around 4, you need about 78% of the population to have caught the disease to stop the growth of the disease. And by any estimation, only about 10% of the population have had the disease. This means that without measures in place, it would likely be 7 to 8 times worse than the current situation. I'm sorry I didn't get to go into the other points, but my partner will carry on with that.
Excellent, thank you. Another round of applause for another excellent speech. Thank you very much, Jasper, for a strong opening to the opposition side of the case. Clearly a team which has been doing their research and has a lot of facts and figures at their fingertips. We'd expect nothing less from a Goldsmiths student, obviously a reputable university with incredibly hardworking students. Brilliant. I'm seeing Dr. Gerson with her hands thumbs up, and there's a good reason for that. So moving swiftly on to our next speaker in the debate, Dr. Yael Gerson. Dr. Gerson is an academic, a lecturer and researcher at Goldsmiths University, which indicates why she was so complementary towards the standard of students that we have, because that's a reflection on her teaching, and I'm sure she'd want it to be positive. So as I mentioned, Dr. Gerson is a researcher and lecturer at Goldsmiths University. She's in the Education Studies department, which is also my department. I've had the pleasure of being in a number of her lectures, which have always been very interesting. I'm sure her speech will now be no different. She's giving a certain look, but I'm sure we're going to hear a lot of incredibly interesting points from her perspective. Her specialism is looking at digital and online cultures and learning. So there'll be some useful insights, I'm sure, into the online world we find ourselves in at the moment. And as you've also seen in the background, no doubt, around her, she is also a working from home parent at the moment during lockdown. So I'm sure has her own particular views on schooling as a way to take the kids out of the house for a little bit. I'll let her speak for herself, though, and now hand over to the second speaker for the side proposition, Dr. Gerson.
Thank you so much. I've got 4 minutes, is this right? Okay, so very quickly, that was Luna, which some of you would have seen. And I literally just asked her, do you think we should try and keep schools open as much as possible? To which she replied, yes. So, I mean, I'll still say my words, but I think her words speak a lot. I was actually reading a report recently by UNICEF, and her executive director said something that was quite impactful for me. And she said the signs that children will bear the scars of the pandemic for years to come are unmistakable. So I want to build on what Shona has already told us in relation to what education does and brings to children, but also reflecting on my experience both as an educator, as a researcher, as a parent, and as a mother who in the first lockdown had to homeschool a then 3 and 6-year-old while they turned 4 and 7, and they've spent a whole year in lockdown, but luckily we're able to go to school as key workers. So, you know, I think I kind of have that experience. And I think the main thing that I want to put across is that the risks to children and young people by keeping school closed by far outweigh any of the benefits that any of the data or stats can tell us. Why? Well, schools are a potential route out of poverty, and sometimes they're the only way out. School closures will only widen these gaps of inequality. Already research indicates that in the global south, the number of monetary poor households could increase by 142 million. And that was by the end of 2020. Second, in relation to replacing face-to-face, so already Shona told us all the things around safeguarding and stress and mental health. There's 2 main things about the online. The first are the risks that were associated, because we did go into lockdown like this and everybody just moved the offline world online, not really understanding the different kinds of interactions. So, you know, we had the kind of, you know, Zoom porn bombs, we might get one tonight. but also extremist messages, the targeting of people. And households weren't prepared to kind of have the right protection in place, right? So there were days where I had to be online. My husband, who's a teacher, had to be online. My daughter was like online teaching. I had to give Luna my mobile phone, and it was like 4 people on devices. Nobody's controlling what anybody else is doing. That puts like a really high risk. And, we're both kind of educated, middle class, people that, you think we could mitigate these risks, but actually it's kind of really problematic, right?
Point of information.
Sorry?
Point of information.
Yes.
See, what I agree that keeping schools closed did obviously lead to so many bad things. Do you think opening schools in the state they would be open in the middle of a pandemic actually resolve any of these issues?
Yes, absolutely. Because it is that continued thing, right? I think it's the closing of things. You're not giving that continuation to people's lives, which is precisely the role that teachers have in looking at kids from a complete child perspective. You also need to consider the impact that it's going to have on working parents. So you don't only, it was all these like key workers. So you need, you still need bus drivers and nurses and doctors and everybody. And as somebody who had to work full time whilst looking after kids, it's unsustainable. It's unsustainable for us. It's unsustainable for kids. We know the levels of domestic violence raised increased so much. This is only going to be more problematic when people are stressed by their work. And so the one thing that I want to finish on, and just to give you a kind of global perspective, I'm from Mexico. In Mexico, schools closed a year ago. So on the 16th of March, 2020, every level of school, nursery, primary, secondary, university, they have remained closed all year. Mexico has the 3rd highest number of deaths in the world. I do not think closing schools had that benefit.
Perfect. Thank you very much, Dr. Gerson.
Sorry, I normally talk for like an hour. Simon knows.
No worries at all. Yeah, lecturers used to speaking for an entire hour-long lecture have to condense it down into 4 minutes. Now, that was incredibly succinct, incredibly informative. Thank you very much. To quickly address any questions the audience might be having around why it is that I'm clapping constantly during speeches. It's not because there's a fly buzzing around that I'm trying to deal with it in the vicinity. What I'm doing is I'm clapping at 30 seconds into speaker speeches and 30 seconds before they end. And what that does is to indicate to other speakers from the other side that they are leaving what's called protected time. So the beginning and end of a speech, speakers are allowed to get into the flow of it or to wrap it up without being interrupted. But in that middle portion, while they're unprotected, as you've seen, they can be offered a point of information by another speaker. We get a lot of these traditions from the old-fashioned British Parliament. So it's point of information you might see in the House of Commons. We do it here as well. So that is an optional interjection. So you saw there, Haider had a question for Yael. Yael then accepted it. Early, you saw Shona declining a point of information. So it's up to the speaker to engage with that question if they'd like to. Obviously, debating is always about that kind of responsiveness and engaging with the other side's opinion. So it's great to see a question there being responded to and responded to very, very well and very clearly by Yael. Just no, I reject that, which is always good to see. There's a lot of debaters who find it hard to form an opinion. It's like, oh, I can see one side, I can see the other. Sometimes you need someone to just put their foot down. So thank you very much to Dr. Gerson. We have one more speech left before we'll be opening the debate up to the audience for some questions for those of you who are joining us. So we'll be going now to Haider, but after his speech, we'll be coming to you. So be thinking now of any questions you'd like to ask to one side or the other, or even an open question you'd like to pitch to both. And then those questions we responded to in the 3rd and final speeches of either side. Before that, though, as I said, we have one very important speech to go. So the second speaker for side opposition is Haider. Now, Haider is a 2nd-year medical student at Imperial College. So I've been seeing on his stories every other day, he's been out there actually administering vaccines. So there's some more, one of our key workers, we'll give him a clap every Thursday. He's been doing great work in making sure that we're able to actually reopen schools again and get to meet each other on park benches in groups of 6 and so on. As well as his experience in the medical field. He's also a prolific debater. He's been debating since he was about yay high. You can't see how high up that is, but he was pretty small when he began. Was debating all the way through school, and he spent some time as a program director for the charity DebateMate, teaching debating in schools. So a lot of background in debating and education and healthcare. You can see why we wanted him for this debate. And so I hope And I'm sure everyone's hoping for an incredible speech now from Haider. No pressure at all after I build you guys up like this, I realized. Anyway, the microphone is yours, Haider. After you will come the questions, but before that, what do you have for us? All yours.
Thank you, George. I'd first like to start my speech with condolences to all the medical professionals, teachers, children's parents, people who've lost anyone during the pandemic. And I don't want to be insensitive at any point, and I'm going to try my best not to be. If I do come across as such, I do apologize in advance. So in my speech today, I'm going to be talking about why it is that we don't get the benefits that proposition so dearly wanted in their speech, right? Because Shona and Yael both brought brilliant points about how not being able to be in education has caused so many issues for children, and in terms of development, in terms of learning, in terms of socialization. We accept that on side opposition. However, I think that the way the state in which schools would be and have been opening in the pandemic just isn't going to solve these issues. And we think having opened them for the whole pandemic, or even keeping them open now, even if there's another wave, would not solve these issues. Why is that? Well, I'm going to take you through that. So firstly, I think it's important to understand children don't really follow social distancing in many cases. Why is this? 4 reasons. Number one, they often have less personal experience through knowing fewer people, through being younger, through being less vulnerable, less likely to catch it, and so on and so forth. They have less personal experience with this. There are far fewer children who are like, I think I had that last April. I remember what it felt like, and therefore I follow social distancing. You don't really see children talking about that as much. And note that they can't get the vaccine. It's not been approved for under 16s, and so they can still transmit the disease. This becomes more important later on. Secondly, they don't identify with the groups they see in the news who are getting ill and dying. They don't identify with a 60-year-old on a ventilator, on a news program, or on a poster. That poster which says, wear your mask, tell me you wouldn't wear your mask, and it shows an old person. They don't relate to that image at all, and rightly so. Thirdly, there is less grasp of science with younger children, especially under the age of 12. They have less understanding of transmission of disease. You don't really cover droplet and airborne transmission of disease until GCSE, quite early, like at the very most by A level. And fourthly, the kids have been trapped indoors. Like, even if we take them at the earliest, like weirdest hypothetical version of this debate, we're talking about opening schools from September. The kids have been locked in all summer and they haven't been able to see their friends. A lot of these kids are like, well, I've done all of this, I've given all of this up. And you see this all the way up until my age group. I know there are people at university who, when they're in university, will eat lunch with their friends. Doesn't matter if there are more than 6 of them. We haven't seen each other in ages, and it's been a while and no one's really looking. And I've only been in contact with my school and so on and so forth. And we think that is amplified with younger children, right? What does this lead to? Tell you, number one, they can still transmit the disease. As I mentioned, they're not vaccinated. That means if they do carry the disease, they're not less likely to transmit it, and they're also not less likely to become asymptomatic carriers, as we've seen the studies of those who are vaccinated. And what does that mean? They can transmit it to those who are vulnerable, right? Your teachers, your parents, your elderly grandparents, people who are in the bus with them. No, thank you.
Clarification is the assumption that if kids go to school, then they're going to be seeing grandparents, and that's going to extend to a wider community?
I think that, well, in the vast majority of cases, young children live with their parents, and I think that means that they are likely to transmit to their parents in the event they are exposed. And I've already explained why I think they're likely to be exposed. But importantly, it doesn't even matter if they are exposed, because what it leads to is this fear, right? You get teachers who aren't willing to go into school. You have parents who aren't willing to send their children to school. If your parents, like mine, are elderly and have like a number of other comorbidities, things like diabetes, things like obesity, things like previous operations, they're not going to want to send their children into school. My younger sister wasn't allowed to go into school for that exact reason, right? My parents were afraid that she would bring something back home and it would cause so many other issues. Now, what does this ultimately mean? It means that when you open schools, you don't get this beautiful continuity that we had pre-COVID, because unfortunately, that is not the world we live in right now. Instead, you get schools which open and shut depending on the waves of the graph you see when you type in UK COVID, and what I check almost every morning, because honestly, there's nothing better to do. And that means you get that same interruption of education. And what that means is children aren't learning, they aren't being socialized, they aren't getting that continuity that is so vital. And so we think that, honestly, on balance, you don't get benefits of children, but you do most likely risk them, their parents, their families, communities much more, which is why I'm so proud to stand in opposition. Thank you.
Excellent. Thank you very much, Haider. Another huge round of applause for another absolutely storming speech. You see, I build them all up and they still come forward and knock it out of the park. So that's why I feel very comfortable hyping up all of our speakers so much. Excellent. Well, that's enough of our speakers for now. We'll put a quick pause in the debate and come to the audience for questions. So the way that we'll do this is, if there's anyone in the audience, and I'm hoping there'll be a number, who have any questions or something you'd like to ask to a particular speaker on either side, or to a team, or indeed an open question for everyone to consider, if you could, in the chat, just type in the chat, "I have a question," and then what I'll do is I'll call on people one by one to unmute themselves and ask that question. Or if you don't have a working microphone, you can just type your question out in full in the chat, and then I can read it out for the speakers. And so those questions, again, to reiterate, will not be responded to immediately. Those will be responded to by the summary speakers. So the final two speakers in the debate, Afzal and Joel, will be picking some of those questions to respond to in their summaries. So at this point, I'll ask, does anyone have a question that they would like to ask? If so, let us know now. This is your chance to ask doctors, teachers, and other professionals, other experts in the field, what they think in response to any questions you might have. Okay, we have a question from Hannah. Yes, Hannah, go for it. If you want to unmute yourself, just let us know which side the question is for, so that the summary speakers know to listen out for it, or if indeed it's to both sides, then let them know, and then tell us your question. Over to you.
Hi, I have a question for the proposition. So I am a teacher at a school in South Oxfordshire, which had very low rates of COVID in comparison to many parts of the country. However, before the first lockdown, we were about 2 days away from closing because we could not get the staff in. It's still very difficult for us to get agency staff to cover. On top of that, we've had a number of teachers this week who have had vaccines and have taken at least 2 days off because of the side effects. We have not had agency staff in, and so staff are covering that. What would you say in response to those issues?
Excellent. That's a really great question, Hannah. Thank you very much. I noticed as you are asking your question, Joel's flatmates recognized their friend and were like, "Oh, it's Hannah, it's Hannah." I wanted to come see you. Excellent. Thank you. It's great to hear perspectives as well from more teachers. It's always wonderful to see the kind of community that we get coming to these events. We have all kinds of people from both students, alumni, staff, people from all kinds of different departments and different backgrounds. So great to have some teachers here as well. Thank you. So that's a question for the proposition there. Do we have any questions from anyone else? Let us know. We have time for a couple for either side. So let us know now. I'll just keep vamping and filling time while people type out. There we go. All right. Simon also has a question. Simon, over to you.
Hello. Yeah, I've got a question for both sides. I'd like to know what you think about whether this is given a positive or a negative opportunity to kind of augment the curriculum which is chosen in schools, or whether parents are able to put a positive or conversely a negative spin on the kind of life lessons that their children are learning at home.
Excellent. Thank you very much for a great question, Simon. One for both sides to consider there. I'm seeing all the speakers nodding like, damn, these are some good questions. Yeah, I told you, we get the best and brightest here at Goldsmiths. They're all trained by Yale, so they know what they're doing. Brilliant. Any more questions from anyone of any sort? Yes, Maurice, go for it.
So I have a question for the opposition. I've heard that from more data, it looks like that children up until the age of 12 are more or less not that endangered by the virus, getting infected as well as infecting others. How does this affect your position?
Excellent. Thank you very much, Marisa. Again, people doing their research. We've got some stats and figures here. Another great question. One for them to have to consider. Excellent. I think we have time for one or two remaining questions. If anyone has anything that they wanted to add to the debate, or even if it isn't necessarily a question, more just a statement, something that you wanted to say, something that you wanted to add to the discussion for them to have to consider and grapple with. Okay, final call for questions. If anyone has anything, speak now or forever hold your peace. If you don't ask it now, you have to just vent in the comment section once this gets posted on YouTube. That'll be your last resort. Okay, Excellent. So what I'm going to do before we move on is, I know normally the chair doesn't ask floor questions, but I have a question I'm just genuinely curious in, and there's no one in charge to tell me I can't. So I'm also going to ask my own question for either side, just to see what the speakers think. So the question that I wanted to ask, and this is for either side to consider, is what kind of impact do you think the decision to keep schools open had on the signaling and messaging that the government was putting out about the current state of the pandemic? Do you think that by keeping schools open at particular times, the government may have led people to believe that things were safer than they were, and that maybe would have encouraged people to go and break other rules and regulations? So did you think at any point that could have potentially undermined other regulations that are out there for adult staff to follow? Or on the flip side, do you think the reopening of schools at some points could have been a way of keeping morale up and actually encouraging people that there is a way out from this? In particular, reopening them now has had a big, potentially major effect on public mood in what has been a very low point of lockdown. So I know it's unconventional for the chair to ask a question, but hey, I have this captive audience, so I'm going to ask them some questions while I have them here. This Avengers team of experts we've got here. Excellent. So we have two speakers left in the debate. So we'll be hearing from Afzal and then Joel. What's slightly different about these speakers for either side? So as the final speaker of their side, what you'll see them doing is providing more of a summary of the debate, often quite a biased one, to explain why they think their team has won the debate. So we've already heard two speeches from either side putting forward some substantive arguments in favor of their side of the house. And then what these summary speakers will be doing is collating all the information, everything that everyone said in this debate, weighing it up, also factoring in some of the floor questions and trying to explain why they think their side has come out on top, and why you in the audience vote will be doing at the end should vote for their side. So they've got a pretty hefty responsibility, but we've got two very excellent debaters to rise to the occasion. So first of all, we'll be hearing from the opposition summary speaker. So the opposition, as I said, we take a lot of these conventions of the debating formats from old style British Parliament. There's a common tradition that the proposition, those who propose the bill, will both begin and conclude the debate. They get the first and last word. So we'll be starting with the opposition summary speaker, Afzal, and then Joel will get the final word in the debate, which I'm sure he absolutely loves, having no one who gets to disagree with him afterwards. So Afzal is going to have to do his best now to solidify the opposition case, because this is their last word in the debate. A little bit of background on Afzal. So we've been talking so far in the debate about school children and the effect it has on them. And we've, as always, the Goldsmiths Debating Society want to try and be inclusive. And so we have here in the debate an actual school student. So Afzal is in year 13. He's studying for his A-levels at the moment. He has not been having a fun time in the last year, as you might expect, with the pandemic. And so when I asked him earlier, before the call started, I asked him, so how have things been? There was a big sigh at the start of, well, and so I'm sure some of that frustration will shine through in his speech. So Afzal, as well as being a school student, he is also a member of the England national debating team. He's going to be representing England at the World Schools Debating Championships next year. So it's a huge achievement to be selected for the team, one of only 5 students in the whole country to do so. And we wish him all the best of luck next year, but we wish him even more luck for the speech he's about to give us now. So to conclude for the opposition on a far more important debate than any of the debates you'll see at the World Schools Debate Championships, I'll hand over to Afzal. Afzal, over to you.
Thank you very much, George. The first thing I want to clarify is that on side opposition, we're not standing for schools to just remain shut. To give you an example, back in autumn, there was suggestions of a circuit breaker lockdown in order to prevent a surge in coronavirus. At that time, the politicians didn't want to push for a lockdown with schools because they were afraid, to be quite frank, of the political ramifications. We think then we would have said yes, put a lockdown including schools, because what came after in January was that is when they had to do it because the circumstances were so dire. So that's the difference between the two sides. On our side, when there is a very likely chance of harms being happened, we'll err on the side of lockdown. On their side, they're likely going to continue until the situation is very dire. And this leads me on to George's question, because the first thing George asked is that, what is the political signaling effect? I want to be quite clear here. When you don't have lockdowns with schools, but when you allow schools to continue and you don't have other things, I think the fundamental message is that it isn't as dangerous. For example, the autumn lockdown had the most prolific amount of individuals breaking it. There were individuals traveling from all the way to Wales to go to McDonald's and so on and so forth. And I think it just shows that there isn't a lot of faith in the government when that happens. The second question is this idea about 12-year-olds. And I think that's a really important question. But luckily, we've got Haider, who's a doctor and he knows his stuff, or a medicine student. And well, even though 12-year-olds have lesser chance, it's still a 1 in 5 chance to transmit. And after the age of 12, they have the same chance as adults to transmit. And this leads me into 2 questions I want to ask in this debate. Are children the most responsible? And secondly, which side has more or less lockdowns? On the first question, are children more responsible? And I think Haider was quite clear in laying down the facts. Look, as a child myself, I had lockdown back in Christmas. Afterwards, I was like, not lockdown. I had coronavirus. And I was like, you know what? It wasn't so bad. And in hindsight, I wasn't as careful afterwards as I should have been. I went running to the park with my friends. And the key idea is this: as a child, you often feel like you are quite strong because of the narrative we see in the media, where the most victims are children, are older people. The fact that we see adverts with elderly individuals and not our kids. And even the examples of playground fights happening in Shona school, that shows how kids don't really think about social distancing when they're punching each other in the face, right? But the second thing, and the most important thing here, is that, look, even if kids are vulnerable, it doesn't mean teachers aren't. The vast majority of teachers often are individuals who aren't young teachers, but rather individuals who are somewhat vulnerable. Importantly, because we know that in the previous lockdown, the teachers' union threatened to strike because of the massive risk imposed upon teaching staff. And I think this was clearly outlined by a question from the floor by Hannah, who told you that there is a massive risk to teachers and that massively harms the quality of teaching. So the second idea of is lockdown and which side has more. And this is really important because look, we're going to concede that on our side, we have more lockdowns, but rather the longer lockdowns, as opposed to their side of the house, when you have a 2 month of schools continuing, then in January you have a lockdown again. I would posit that their side is harmful. Why is this the case? Because you have less certainty, and that's really bad. As a kid in year 13, I had to wait months before finding out how my future would be decided. I think that is a horrible thing to do because on a psychological level, it's very hard to be productive already because I'm at home, already because I have Zoom lessons, but especially because of the uncertainty, because when the government is responding to political pressure as opposed to the science, that's when they're unable to do things that is necessarily good for students. So on a comparison, I fully agree with side prop. There's a lot of harms to kids, but I think giving them a little bit more harm versus giving them certainty that knowing here's what's going to happen in the future is something that we're willing to trade off. At the end of this debate, I want to say is that, look, children may be our future, but we need to think about the present. And for that reason, vote side up.
Thank you very much, Afzal. You're seeing exactly why the Scouts picked them on for the England debate team. Excellent. Well, thank you very much, Afzal. Thank you to all 3 of our opposition side speakers. So I'm sure you'll agree is a very compelling case for their side. I'm sure there's a number of people who are maybe starting to change their opinion from the beginning of the debate. Proposition have one last attempt to retain the majority advantage they began the debate with. So as a reminder, again, at the end of the debate, we'll be putting up the post-debate poll. So be ready to get back onto our Instagram. Give us a follow again if you haven't already. And then you'll be able to vote for which stance you're now taking at the end of the debate. So we'll get to measure that interesting shift from the beginning to the end to see who's changed their minds. We have one final speaker before the debate ends, though, and it is going to be a good one. So for the final speaker of the proposition, we have Joel, or rather I should say Dr. Joel J. Richardson. So Joel is a junior doctor. He's an intensive care doctor at St. Mary's Hospital here in London. He's been working specifically with coronavirus patients. So again, a quick round of applause for our frontline workers, for our NHS heroes. That's been Joel. Joel, before becoming a doctor, while he was studying at university, was a debater. I had many opportunities to lose debates to him because he's very, very good. He was, in fact, a quarter-finalist at the European Debating Championships back when he was representing his university, which is not at all shabby, top 8 in Europe. Joel, I'll stop embarrassing you now by putting you on the spot and actually just put you on the spot, and so you have to talk for yourself. Final speaker for side proposition and indeed the debate as a whole, Dr. Joel.
Oh, just put time on. So I want to talk about a couple of things in this speech. I think the main issue with the opposition team is that they did not really clarify exactly what was going to happen on their side. There was a lot of allusion to transmissions and all lockdown and all that's bad, but they never really told us exactly what would happen. Because we got an entire speech from Haider about how children don't social distance properly. And that's true, they don't, they're terrible at it. However, we do know that despite the fact that children don't social distance properly, when schools opened, there was no corresponding jump in coronavirus cases. That is to say, no matter how plausible it is that they might spread it if they could spread it, the fact is they don't spread it, and we have the numbers to back this up. Now, Afsar wanted to tell us that this was 1 in 5, a number that he impressively plucked out of thin air, and it was a really nice try, but probably would have been worth doing if he'd gone last. That's made up. It's not true. We know that when the pubs opened, numbers spiked. When restaurants opened, numbers spiked. When schools opened, numbers don't spike. We know that children don't get severely sick with it. We know that they don't pretty much ever die from it. So there's not really any harm they can actually generate beyond kind of alluding to the fact that they might spread it. But the fact is, now that we've seen that they don't spread it, it's not harm that we have to be scared of. So in the first lockdown, as we heard from the first speech, maybe it was reasonable, maybe it was sensible. We didn't know what the harm would be. But in the second lockdown, in the summer, when we decided to keep schools shut, but open your local pub, that was a bad idea. That's something that we oppose. We think that was harmful to children. We think that we now know that it's not harmful for the schools to be open, but we've heard all the way down our bench, not really got any response to the fact that it's immensely harmful to the children themselves from the lockdown, right? So there's not really any harm to opening the schools, but there's a huge harm to shutting the children away. A few points from the audience I want to respond to. The idea of staffing. Yeah, there are obviously problems there, but it's obviously still much better when we understand how bad it is to shut a school, that a school opens with not full capacity, like teaching most of the children, giving most of the children access to their school meals, most of the children access to counselling, maybe a few of the teachers zooming in. It's still a lot better than having the entirety of the school shut with those children totally disengaged. On the idea of signalling, maybe it would be bad if the government opens signals that the things are doing well because the schools are open, but at the stage where they kept the schools shut and opened the pubs, I think the signalling effect is already pretty buggered at that point anyway. I don't think you're really benefiting by keeping the schools shut. So that's not really a benefit at all, right? Like at the end of the day, we know that when you open the schools, and in addition to that, when you open the schools, the cases don't vary very much, right? And we heard from Yael specifically in Mexico, like the place with the worst number of deaths also had the strictest school lockdown. That is to say that there is no correlation at all with the amount that you lock down the schools and the students and the amount of deaths and kind of morbidity from coronavirus. That is to say, to all the knowledge that we have, there is not really any significant, or at least there is probably not any kind of significant effect on coronavirus and cases and deaths society-wide from schools being open. What we do know for certain is the immense and damaging effect on students themselves that we've heard all the way down the bench, right? We've heard about how you get issues in terms of like your life aspirations, how you get more people trapped in a poverty cycle. Like you'll explain how hundreds of millions of people who relied on schools aren't going to get that benefit to get out of poverty. And poverty itself is lethal in the long run. We heard from Shona about the impact on the mental health of students, the fact that students don't get access to counselling, that they're locked away in a room and basically are far more prone to depression, anxiety, things in themselves which are very damaging and lethal in the long run. We heard about how students are more vulnerable to abuse and don't get that picked up by people at school. We heard about how they don't get access to free school meals, actual food, right? How like half of the students in April didn't get the free school meals that they were meant to have. Like all of these are very concrete, very obvious, very clear, absolute detrimental effects, right? Because at the end of the day, like the reason that we care about death is that it's the waste of a life, right? It's damage to a life, it's scars that you can't repair. But that's what we're doing these children to. 60 to 70 years of a life ruined, of a life thrown away that didn't have to be destroyed by coronavirus. And this is going to affect hundreds of millions of children the world over because they never got the schooling, they never got the benefits that they should have had. What are we doing? Well, we know that we're not really saving any lives by it, maybe a few thousand, but we're throwing hundreds of millions of people's lives away in order to protect lives that we probably aren't even protecting. We think that we can't afford the luxury of saying, oh, maybe we'll be cautious because we know that we're doing harm, and that's incredibly irresponsible, and we need to keep schools open as much as we possibly can. Thank you.
So huge thank you to Joel taking a time out of his busy schedule, saving lives to come and give us an amazing concluding speech to the debate. Could we please offer another round of applause to all of the speakers in the debate? It's excellent, excellent stuff. Thank you all very much.